research designs. And one of the reasons I like research design so much and issues related to doing research is that for whatever the reason may be, we all assume that we live in this great and dandy, there's rainbows everywhere, everything is perfect kind of world where we can't do anything wrong in terms of our research. And one of the ways that I've always kind of compared to doing research is to having a child. Whenever it is that we build a research study and we're carrying out the research study and we're doing the stats and doing the conclusions and writing everything up and presenting, we're literally talking about our child that we've been working on for a number of years. And sometimes we've had some research projects that have been in the pipeline for longer than what it is that we've actually had children or that we've had friends. And then people come in and point out certain things and they give you issues related to your topic. And what did you think about that? And what about that flaw? And what about this issue? And what about that? And it's like them telling you that your baby's ugly. And we never want that, right? And the first thing that you do is you become really defensive. And one of the things that I've kind of learned over the years is that I can never go into the mindset that I have a perfect project. I have to go in with the mindset that there's going to be flaws, that there's going to be imperfections. But to the best of our abilities, we've done the work that we're presenting. And hopefully what we've done is we've tried to minimize some of the issues and some of the confounds and variables that may be impacting our work in terms of error variance, and we're trying to minimize their effect. That's as best as we can do. So in other words, we've tried to have the best looking kid out there in the world. They're not exactly 100% beautiful, but hey, you know what? We like them and we love them and we think that they're perfect. All right. So let's begin talking a little bit about, again, the research process. You know, every time we talk in this class, I always bring up the research process and I always bring up issues related to how it is that we even conduct research from the get-go. And we always have to think about the research process existing in 4 steps. Step number 1 is that we identify that an effect even manifests itself out there in the real world. So we have anecdotal evidence that may suggest that whenever it was that we studied 4 hours versus 8 hours, we perform a little bit better on the exam, or whatever the case may be. We have all this evidence that may have accumulated or that people may have informed us about that this potentially may have existed out there in the real world. So we may have some general sense of that idea. The next step then that we take in the research process is that we identify when, where, or for whom the effect actually occurs. And essentially what this means is that we're identifying what we call our moderators in research. So in other words, we're saying that when you study 4 hours versus when you study 8 hours, this is the result that should potentially occur. Not that it will always occur, but that it should potentially occur in these situations. The next logical question that we always have in the progression of science is to ask the question of why. Why does that effect actually manifest itself, or why does that effect occur? So why is it that when you study 4 hours versus 6 hours, you find differences in terms of your exam performance? And again, many times whenever it is that we talk about this why component, we're talking about biological aspects, because when we talk about those aspects, we're really getting to what we call the mediator component, that we're saying this is the rationale as to why that specifically occurs out there in the real world. And generally, like I mentioned, you know, it ends up being a little bit more biological in its nature, that we talk a lot about the brain in those particular instances. And then last, we talk about definitive causality, which again, this is the thing that we're always striving for. We talked about this whenever it was that we discussed the issues related to experimental versus correlational research designs. We talked about it whenever it was that we talked about the importance associated with designing your research projects from the get-go, talking about David Hume and all these particular issues, because again, we continue to find that this is a very important issue related for us within the scientific domain. So in other words, we're always striving to find causal mechanisms existing in terms of our research studies, but yet there's no guarantee that we're ever going to reach causation. So most of the time, again, we're left with the idea of finding relationships between our variables, so between the independent variable and the dependent variable, but at least we're getting to the point where we're trying to potentially discuss issues related to causation. So again, for us, it's this elusive holy grail that we always talk about. Now, since we've talked about causation so much already, we should all be very familiar with the ideas of what David Hume proposed for us. And the ideas of what David Hume proposed for us was this idea of causality and how it was that we should establish definitive causality. And the way that David Hume proposed this idea of definitive causality for us was in the following fashion. Again, there's 3 specific conditions that we should be able to satisfy and identify: the issues related to covariation, the issues related to temporal precedence, and the issues related to internal validity. Again, we've talked about them hundreds of times, and we'll continue to talk about them hundreds more times because they're that important for us. The idea of covariation, that whenever it is that we change A, our independent variable, from one level to the next or from one group to the next, we should see an accompanied change in our dependent variable in B. We also find the issue related to temporal precedence, that A must come before B. So in other words, our manipulation or our control, our independent variable, should occur prior to measuring the dependent variable. And last, the issue related to internal validity, which again is the most important issue that we talk about whenever it is that we talk about research methods as a whole. This issue of making sure that we're trying to establish that A does definitively cause B by making sure that we can satisfy and try to limit all other potential factors that may contribute to those differences in our scores that aren't due to the researcher's manipulation or control. So in other words, we're trying to reduce the issues related to error variance in these particular cases. Any questions up to now? Perfect. So as a good researcher, as a good scientist, part of what we're always doing is we are working towards this aspect of causality. Again, it's step number 4 in the scientific sequence here, that we're always trying to get to this idea of establishing causation. But again, we realize it's so difficult for us to be able to establish, but it doesn't mean that we stop trying to get to causation just because we know it's not likely that it will actually happen. So what is it that we tend to do then in these particular instances? Well, we always try to establish true experimental research designs so that way we're able to then definitively establish that A does truly cause B. So how do we do that? Well, first of all, we're going to try to establish a true experimental research design. And again, remember, there's 4 criteria that we always look at with the true experimental research design. They're the issues of having true random sampling, true random assignment, having a manipulated independent variable, and last, having the issues associated with internal validity, having a high degree of control in our research studies. So if we're able to establish these potential factors, these 4 criteria, then we're going to be allowing you to be able to draw causal conclusions with a little bit more certainty. Now again, it always comes down to that issue related to error variance, that issue related to internal validity. Because again, we look at issues related to reliability, issues related to validity. We continue to talk about individual differences and confounds. And why do we stress this so much? We stress them so much because we realize that within research itself, especially when dealing with humans, it is such a difficult scientific study that we do with human participants, and that there's so much variability between one participant to the next. And that makes our job so much more harder to be able to establish true causation, especially when I'm trying to establish and make sure that I eliminate all other possible extraneous variables that we may have in those types of situations. So for us to be able to definitively say that A does truly cause B, so my intervention technique does truly decrease the symptoms associated with depression, that's going to be the most difficult thing for me to be able to establish in terms of a causal mechanism. So 99% of the time, what are we going to be left with? We're going to be left with relationship conclusions. So you implement this type of strategy, you implement this type of intervention technique. We see this related to a decrease in terms of symptoms related to depression. Not that it will cause the decrease in symptoms related to depression, but at least we're going to see that relationship decrease in that potential instance. So again, we're trying to establish that our results are due to the systematic variations due to our manipulation and our control. In other words, effect variance, and not due to error variance. Everyone good? Perfect. So again, it comes back down to this issue of, can I really do this? And the answer is probably not, but I'm going to try to do it to the best degree that I possibly can. And this is why we tend to see a lot of research articles make inferences or try to draw conclusions associated with causation, but not really saying that the mechanism does truly cause that effect. So they'll say things such as, well, we do see that there may be this causal relationship that may exist. And whenever it is that people say that this causal relationship, I think to myself, and I'm like, those are 2 contradictory terms, because if you're saying causation, then you're not saying that they're related, because you're saying that the cause is there, the mechanism is actually there. Then just say one or say the other. but generally you'll see those kinds of statements being made, or you'll see other statements related to it that they'll say that we can infer causation. Not that we are, but because we realize that there may be some error variance, but at least we're saying that this may potentially be the causal mechanism. So here, as more and more stricter you become in your research studies, and the stricter you become trying to establish these 4 criteria associated with the true experimental research design, and especially with internal validity, the more confidence and the more leeway we give you to draw these ideas of potential causal conclusions. Not that you are drawing causal conclusions, but that potentially we're giving you a little bit of that freedom. We're letting go of the range just a little bit and letting you control that aspect in that instance. Questions, concerns? Perfect. All right. So what are some primary issues then that we find associated with research designs? To be honest, there's lots of issues out there. And I think if we were to try to write a textbook about how to deal with research design issues, we could literally write 100 volumes and not get through everything. So rather, what have we done within the field of psychology? We've really kind of talked about the major issues related to research designs in terms of them being experimental in their nature, because again, we're trying to get to causation. So in other words, we have problems associated with the 4 criteria associated with true experimental research designs. What are some of the potential problems that we have? Now, as you'll see, as we're going through the lecture today, we're going to talk about a lot of other issues that, again, most of them don't even come up in textbooks. They don't even come up in articles as points of discussions. But yet that's part of what we're trying to do. We're really trying to identify what kind of issues are out there, what kind of issues is it that we identify or that we find within the research realm that we can try to prevent in the subsequent studies that we might be doing. So when we look at research designs, experimental research designs, the first issue that we always come across is the issue of representative samples. Now, you can go out there and you can find tons of books related to this idea of representative samples and how to actually sample correctly from a population. And one of the things that I always recommend for everybody to do is always go in and try to identify what it means to have a representative sample from your population. Because what may be representative for my population may not be representative for other populations of interest that you may have. So for instance, I have a friend of mine who's a sociologist, and one of the things that him and I would do, we haven't done this in quite a while, but him and I would kind of have these arguments about once a month, is that he would always critique psychologists for using college students as the samples for articles that they publish. And I would always say, you know what? You're absolutely right. That is definitely an issue that we need to look at. That's definitely a concern, but we're not going to stop doing it. And that's just kind of the way that we do things. And then I would say, well, what about you? You know, how do you then sample? Well, we don't sample. We go out into the population and we do this. And I go, so you're telling me that you're going to go into the population and survey everyone? Well, no, that's impossible. So we only get a group of people. Well, then you're sampling. So there's an inherent limitation in that. And he would come back and say, well, but at least I'm going out into the real world and doing that. Yeah, you're right if you want to do that, but where is the real world? Going to Walmart? Going to H-E-B, going to the flea market? Is that the real world? Because that's what ultimately people who go out into the field do. They go out and they still technically do convenience sampling, because they go out into an area that's specialized just for whatever it is that they're interested in, and people who have some inherent interest in participating in the study and that you have easy access to. So again, you still go back to the same issues here, don't we? So there's always issues related to any field, to any study out there. And again, all that we're trying to do, trying to minimize those issues. So with representative samples, the biggest concern that we always have is the issue of generalizability of our results, the idea of external validity. How is it then that we can increase our confidence in external validity? How can I increase the likelihood that my research study, my work, can actually generalize to the larger population using the sample of individuals that I've gathered? And the answer to that is try to get as much of the population as possible to come in and participate. That's the easiest way to solve this potential problem. So in other words, you have a population of 5,000 people and you want to generalize your work that you've done in the lab to those 5,000 people. Get all 5,000 people to come in. Don't just grab 15 or 20 or 100 people to participate. Grab all 5,000. That would be the ideal. But again, I don't live in an ideal world, do I? So rather, what do? We say, hey, you know what? There's 5,000 people out there. I have easy access to 30, 40, 50 of them. That's going to be my sample, and then I'm going to generalize out to the population. Now, one other way to potentially do this is to get multiple samples from that population. So in other words, there's 5,000 people out there. You can randomly sample a couple of times, or maybe even not doing true random sampling, right? Because the idea of true random sampling being this idea that we're giving everyone from the population an equal opportunity to participate. So we're going to assume that you really can't do that. So rather what you're going to do is you're going to do convenience sampling. So you have 5,000 people out there in the population, and what you do is you randomly get, let's say 30 people to come in and participate from your research study that you randomly pick from that convenience sample that you have. So here it is that you got these 50 people to participate. And maybe you have access to those 5,000 people again, or maybe to a subset of them, right? So again, that convenience sampling. So you go back out and you do it again. So now you have these two samples that come from that same population. Even though it's a convenient sample, they were conveniently available to you, they're still hopefully coming from the same population. You can do your study multiple times using two different samples that come from the same population, and I would expect then that I would have the exact same results occur for both of my samples in terms of their generalizability to the population. Because now, if both samples function in the exact same way, and the answers are very similar to each other, and the results don't significantly differ between one sample to the other sample, I'm going to have more confidence that my work can actually generalize to that population. Everyone with me? Perfect. Now, one thing that you always have to be concerned with issues of sampling participants are two very important issues. The issue of convenient sampling, which we've talked about many, many times. So again, we have convenient access to a population, or we assume that we have convenient access to a population. We're going to offer those people the opportunity to come and participate because they're conveniently located there for us, right? The other issue that we may have is the issue of self-selection bias. And the issue of self-selection bias, just like the name gives it away, we have problems with people self-selecting themselves to participate in a research study. And I've used this example in the past that we may have, for instance, a research study related to video games. If you post a note out there on the door that says, hey, I'm doing a video game research study, I'm looking for participants, come in and participate, there's a high likelihood that the people who are going to come in and participate are probably who? Video gamers, exactly right. People who have an inherent interest in playing video games. If they don't like playing video games, they're probably not going to want to go and participate and say, oh, wow, there's a video game study. Let me go and participate, because they're asking for participants. No, people who play video games are probably going to come in and play. So the people that you've now gone as this idea of a sample are really, again, not potentially going to be representative of the sample, the population 100%, but rather they may be more representative of a population related to people who only play video games in those particular instances, not people who may be exposed to video games as a whole. So if we're looking at the issues related to aggression and video game research, right, there's been lots of stuff out there. We always make this assumption, or people out there in the general population make this assumption that you play a violent video game, you're going to do a violent behavior. Play a violent video game, you're going to do a violent behavior. So here we're making the assumption of you play any violent video game, even if you're a gamer or not a gamer, and you're going to go out and do violent acts. But again, who is it that's participating in these research studies? Is it people who are only gamers? And if they are, well, then now we have to think about the population of people who aren't gamers in regards to their violent acts after being exposed to a violent video game. They may become disinterested, they may not want to play, they may just leave the game, and they may not express any type of violent acts because they just don't have an inherent interest in it, and it may not have affected them. Who knows? But we always have to concern ourselves with who these people are. Everyone good? Perfect. All right. The second main issue that we have related to experimental research designs is the issue of what we call equivalent groups. This is always a really big problem for us whenever it is that we're comparing multiple groups. One question that you'll always end up getting is, well, isn't it possible that the group of people that you had in group number one were just inherently different from the people who were in group number two? Well, yeah, especially if they're different people. Of course, they're inherently different from each other. We're going to call that difference a pre-existing difference because these people just naturally are different from each other in these specific situations. So what does that mean for us? It means that if you're comparing two males and one male's in group 1 and one male's in group 2, so they're two different individuals, each male, the male component may eliminate that potential factor of an individual difference, but now you have to look at issues related to their age. So one person is 16, the other person is 19. That's an inherent individual difference. Does one live at home? Does the other not live at home? What kind of schooling have they received? What kind of teachers have they received? What was their grade point average? All these particular issues now, looking at these two individuals, comparing them, something different other than the dependent variable. Now, ultimately, you may find that you have all these different factors, all these pre-existing group differences that may be contributing to those differences in your scores and not it really be related to the issue of your independent variable in those particular instances. Everyone with me so far? Perfect. So what do we do? What do we do in those situations when you're comparing two different individuals who come from two different places, who have two completely different backgrounds? What do you do? Sure. So what do you do in a situation where you have these two completely individuals, right? So you have person 1 in group 1, person 2 in group number 2. They're both male, but they have all these individual differences that are completely different from each other, right? So one is 16, one is 19. One went to private school, went to public school. All these differences between them. What do you do then as a researcher? Do you let them participate? Or do you stop the experiment and say, no, 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 I need to go and find somebody who's very similar to that other person? You let them participate? Okay, so we're willing then to give up internal validity to have participants then, right? Okay. And so let's say, for instance, we are only looking at males who are 16 years of age. So now we've eliminated two factors, right? They have to be male and they have to be 16 years of age. So now we got these two males who are male, 16 years of age, 16 years of age. But again, one went to private, one went to public. One has a one family home. One has a 2-parent family home. One of them has a grandma that they support because they work when they're 16 years old, and the other one doesn't have to work. So then here, what do we do in those situations? Now you have other factors that you have to consider. What do you do? Okay. Perfect. So now what we're doing is we're saying, hey, look, we realize that there's all these issues that are going to come up, right? There's always going to be individual differences, and that's kind of the key here. No matter what you do, you can look for people who are male, 16 years of age, 2-parent household, don't work, public school, X, Y, Z. Every single time you start limiting who your population is, your population starts getting smaller and smaller and smaller. So here, one of the ways that we can fix this kind of issue is, hey, you know what? Just open the doors and let people participate. And now maybe what we can do is we can identify different moderating factors. So when you're male and you have a 2-parent household and you work and you come from a public school, these are the kinds of results and these are the kind of effects that we may observe out there in terms of the real world. Versus this other group, that may be a potential possibility. But now one of the problems that you may have is that since you're limiting your population so much, now your results become very specific to a specific population, don't they? Absolutely. So what's the right answer then? So then what do we do? And the answer is, I don't know, it's up to you. You're the researcher. You tell me. If you tell me, hey, we're going to keep all these participants in, this is what we're going to do, go for it. You just have to justify that for me. You can't leave me out there assuming that I know the reason why it is that you're keeping these participants in there. And for instance, some of these factors may not even contribute to anything. So for instance, you're looking at differences in terms of memory performance associated with stress, and you're talking about people who have excuse me, sorry about that. So you have people who come from a one-parent family versus a two-parent family household. Who cares? How is that going to have any effect? I mean, maybe that has a specific effect on their stress level, maybe, but they're demonstrating equal stress levels initially, so that doesn't really play a major factor. And remember, some of these factors don't matter to us, and some of them definitely do matter, don't they? And that's something that's key. And whenever it is that we're evaluating research studies, we have to think about it in that particular fashion. Are the factors that are in the individual differences, do they really potentially have an effect on the performance outcome that we're wanting to observe? Yes or no? That's really the key, because some of these don't really matter. So participant number 1 was a male 16 years of age who comes from a private school and from a two-parent family household, was wearing a blue shirt. The other guy, exactly the same thing, but was wearing a red shirt. Oh, they're not equal. You see, pre-existing group difference. No. And I just actually had somebody give me that argument the other day. I was teaching a seminar last week, and I was using this as an example. And when I was saying, hey, if we find these group differences that may exist, what may happen? And there was, in the seminar, it was 2 males and 13 females. And the guy goes, well, it's, the male versus female distribution. And I was like, what? Like, we weren't even talking about anything that could potentially have been related to male and female as being a contributing factor to the outcome. We were actually talking about memory. So here the guy's argument was, well, because they're female and we're male, there's inherently a difference. And I was like, what are you talking about? And that's the problem that we sometimes find with research, is that when we look at research studies in those specific ways, we are so nitpicky that we're willing to find anything just so that way we can say that we identified a flaw. When in reality, those flaws don't matter. Or future research. Oh, we're now going to compare males and females. And my question is always, why? We're going to compare people who consume the drug versus who don't consume the drug. Why? Is that going to have a direct effect? Is that something that we even care about? Explain it, justify it. And that's research for us. That everything and anything that we do, we have to justify why we're doing it. Everyone with me? Correct. You justify who your participants are and you say, hey, these are the people that we have, these are the characteristics that we have, and so on and so forth, and we're good to go. And generally, whenever it is that you describe your participants in those specific fashions, you identify specific information that's related to the topic at hand. If we spent all our time discussing who our participants were, every single minor detail, man, forget about it. You're going to have a 1,000-page report that no one's going to read because it's made up of 89 pages or 800 pages of just participant individual differences, because we're all inherently different. So you compare, for instance, oh, there's 2 males, 16 years of age, who both wore red shirts. They're equivalent, but one weighs 187 pounds and one weighs 186. So that's an inherent individual difference. Nah, forget it. You don't need that. So here, focusing on the key stuff that's important. So here, it's a factor that gender really contributes to. Put in there how many males, how many females per group, right? You're looking at issues related to memory, and you're talking about people who are 30 years of age, but some people only have a high school education and some people have master's degrees. You got to identify that, because that's a major contributing factor there in terms of something like memory. Everyone with me? Absolutely. So that's the issue of this pre-existing differences, and people get caught up on this. You will see research studies just fall apart because people get so caught up on this issue of pre-existing group differences and what that means. And part of what you have to understand is it's there to give us this idea of error variance, that error variance never goes away, and we try to minimize it as best as we can. So the groups that we're comparing, we try to make them as equivalent as possible, but we know that deep down inside, they're all going to be different between each other, between groups, and within the group, people are going to be inherently different as well. So you're going to have error variance between the groups, and you're going to have error variance within the group. So you're never going to get rid of it. Everyone good? Perfect. All right. So, what are some other potential issues then that we encounter with this issue of equivalent groups? Part of the issue of equivalent groups is, again, this idea of getting people to come in and participate, and then how to use them once it is that they've come in and participate. So, let's assume here that we've randomly sampled from the population. We've had that ability. We've given everyone an equal opportunity to participate in our research study. We've gone our group of people who are going to be our representative sample in this particular case. And remember, the idea of them being representative is that I should be able to use their results to generalize out to the larger population, right? Because they're representative in their nature. So now we got these people, and now we have multiple groups. What are we now going to do with them? Part of what we can do is we can do what's called random assignment, right? And we've talked about random assignment various times. The idea of random assignment is that every participant in the sample has an equal probability of being in any condition of our experiment. So in other words, we flip a coin. Participant number 1 comes in. They have a 50-50 chance of being in group 1 or group 2. They go to group 1. Participant number 2 comes in. We flip a coin. They have an equal chance of being in group 1 or group 2. We flip the coin. They're also in group 1. Participant number 3 comes in, flip the coin, also group 1. Participant 4, flip the coin, also in group 1. And now you have a problem. And the problem that you have is that you flip this coin, giving everyone an equal opportunity to participate in any one of our groups. And that now, just because of chance, right, because chance exists, you now have 4 participants who are all in group 1, but no participants who are in group 2, right? Now I have a problem. Now I have a huge dilemma. I flipped the coin 4 times with 4 different people. They're all in group 1, and I don't have anybody in my comparison group. What do I do now? And a lot of people, what they start doing is they just start dumping people into group 2. Okay, well, I don't have anybody in group 1. Now let's just start randomly putting these people in group 2. We'll be okay. And this is actually what happens in many research studies when we use populations that come from students. A lot of studies do the following. Semester starts. We have a research study. We offer credit to students, right, at the beginning of the semester. We put out our research study sign-up sheets. Participants come in. So number 1, we're already dealing with the issue of self-selection bias because they're looking at all the different studies that may exist and they're identifying which one it is that they want to participate in. Not that they're getting randomly selected for a particular study, they're self-selecting themselves. So that's already one issue, right? So we're good. Issue number 2. Participants come in early in the semester. Who generally comes in early in the semester for course credit or for extra credit? People who are worried about their grades. Absolutely. People who are generally A students who are going to do anything in their power to be able to get a higher grade, right? Absolutely. People who wait at the end of the semester, who are they? Of course, and we're all into those groups at some point, right? So those procrastinators, right? They're the ones who, I'm not going to worry about that. I'm doing fine. I don't need the extra credit. I don't need to complete it, so on and so forth. And now it's the end of the semester, and they're in a rush to get there. And one of the things a professor of mine used to say many years ago, he would say, I always stop collecting data about midpoint, about part, right? So when midterms occur in the semester. And I would always argue with him and I would say, but you're missing half of the semester to be able to collect data. He goes, but I don't want that crap data. That's crap. And I would be like, why? If it's good data, these people are coming in. He goes, because those are the ones who are going to come in. They realize that they're failing. They need to do all these studies quickly to get as much extra credit as they possibly can. So what they'll do is they'll come in. They'll give you the answers really, really fast. They're done within 15 minutes. They'll go to the next one. And they'll go to the next one, and they'll go to the next one. So within 1 hour, they sometimes can get 3 or 4 experiments done and receive all this extra credit. And you really think that's good data? Of course not. That's terrible data. And he goes, I'd rather just stop. Wait till the next semester, even though it's a couple of months away, and get that good batch of data that's going to come in. People who really want to participate because they want to be able to do something positive for the study. And my argument was always the following. So you're telling me that these people are coming in with their own goodwill and desire to come in and help you? No. I don't buy that for 1 second. I've never had a participant come in and be like, it's okay, sir. You don't have to give me the incentive. I did it out of my own good free will. Yeah, right. No way, man. As soon as they're done, they're like, yo, Where's my confirmation page that says I participated? I need my extra credit. Or give me my money or whatever it was that you were giving them. So we see that all the time. So it's one of those things that, again, it's a give and take. There's no right answer. When do you do it? But he would always say, be careful with when it is that you collect the data, because at the end, that's sometimes crap data that's coming in. So you want to try to avoid it as best as possible in those types of situations. Questions so far? So then what's the solution then? So we're randomly flipping a coin. We got 4 people within one group, and now I'm just forcing people into group 2, and it's the end of the semester. One of the ways that we can solve this problem is by what's been called block assignment. Block assignment is when we give participants the opportunity to have true random assignment. So participant number 1 comes in. We flip a coin. They have a 50-50 chance of being in any one of my groups. We flip the coin. They go into group 1. Participant number 2 comes in. They don't have a 50-50 chance of being in any one of my groups. They automatically go into group 2. Everyone with me? That way you always have a balance in terms of numbers. There's always people in all of my groups. Participant number 3 comes in. We flip the coin. They're in group 2. Participant number 4 comes in, they automatically go to group 1. So here we call that block assignment, putting them in these blocks once it is that we've given other participants the idea or the opportunity of having true random assignment. Everyone good? Perfect. Now, the second way that we can alleviate this issue of equivalent groups is by what we call matching. Matching is actually a really interesting procedure that we use in some instances. And the way that we actually do matching is in the following way. So give me 1 second here, just so that way I can draw a little bit. Okay, everyone can see my screen, right? Am I drawing? Okay, good. Okay, so what we have is we have participants 1 through 5 for group 1. Here's group 2. So we have 1, 2, 3, 4, and 5. And what we're going to have is we're going to have these people come in. So we have Mary come in. We have Paul. We have Peter. We have Perla. And we have Jamie come in. Okay? So we have a female, male, male, female, and male. Sorry. That one should be female down here. Sorry. So we have 3 females and 2 males. In group number 2, we have Stan, we have Chris, we have another guy named randomly Paul. So male, 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 and then we have another 2 females. We have Iris participate, who is a female, and then last we have Patty participate, who is also female. Okay, so one of the things that we can do is we can do the following. We can match participants on things that are inherently different about them. So in other words, we match them on their individual difference. So one of the things that we can do is we can do the following. So group 1 is high stress, group 2 is low stress. And one of the things that we're concerned with is this issue of gender, right? For whatever the reason may be, we're concerned with it. So what are we going to do? We're going to try to match participants up as best as we can. So in other words, Mary's score gets matched up to Iris' score because they're female. So in other words, we can now eliminate the female factor as potentially contributing to the differences in the scores. Everyone with me? Perfect. So here we now eliminate that potential factor. Paul gets matched up to a male, Peter gets matched up to another male, Berla gets matched up to another female, and that's it. So now what we do is we have to eliminate Jamie and we have to eliminate Paul. Why? Because this individual difference that they have of their gender doesn't match up. Everyone with me? That's what we try to do with matching. So we match our participants up on this factor that is already pre-existing group differences for them. So now, ultimately what we can do is we can say, look, across the 2 groups, we already have equivalence in terms of the male-female distribution. So here, whenever it is that we look at our scores should really reflect effect variance and not issues related to error variance because we have this equivalence in our groups. Everyone good? Concerns at this time? No? Perfect. All right. Hold on, give me 1 second here, guys. There we go. Okay. So again, that's very, very a good, useful tool for me whenever it is that we may be dealing with this issue of a person variable that we've used to create the groups itself. So in other words, making sure that we can have those gender differences being eliminated, or those personality differences, or whatever the case may be. Our next big issue that we also want to concern ourselves with is with issues associated with what we call bias. Bias in experimental designs can actually come in a lot of different ways. And one of the ways that we have to consider this issue of bias is, number one, who's giving us the bias? Is it the participant who's providing us with the bias, or is it the experimenter who's participating or who's giving us the bias? So part of what we try to do as a researcher is we try to minimize our effect on the experimental outcome. And we also want to try to minimize the effect of the participant, again, their behavior outside of the manipulation, as potentially having an effect on our experimental design. So I'll give you an example of this. The other day, my wife, who's a dentist, said to me, hey, I really want to create a survey that we give out to our patients whenever it is that they come into the office. Can you help me design it? And I was like, yeah, sure. So I've been helping her design the survey. And one of my concerns is about when to give them this survey. So the survey is just about customer satisfaction. So how satisfied are they with the experience that that we've created for them here in our office, right? And she said, okay, well, how about we give it to them right after they've gotten whatever procedure is done? And I said, that's a good idea, but no. And the reason I say no is for the following reason. Okay, number one, you may have potentially given this patient a drug. You may have potentially extracted a tooth from a patient and it may have hurt or whatever. Do you think that this patient is going to give you a good evaluation after you've taken out a tooth? What do you guys think? Hell no. If you've ever had anything taken out of you and then they're like, hey, how do we do? You're not going to be like, awesome. And people inherently hate the dentist, let's be honest, right? People inherently hate coming to the dentist. They don't enjoy that experience. And now you're doing something like that to them that's traumatic in its nature. People are not going to give you a good evaluation. So I told her we need to pick people who are going to be adequate to be able to give us the data. So I'm already self-selecting people here, right? So I'm already like, oh, it's people who I assume had a great experience. So that's the people we're going to evaluate because we're going to get awesome evaluations. So then the second issue was, well, okay, we get these people who just come in for a cleaning, let's say. Let's give it to them after they've gotten the cleaning. And I said no. And one of the reasons I said no is, well, you as the doctor or the hygienist gives the evaluation to the patient. The patient now feels the undue pressure coming from the doctor or coming from the hygienist who's sitting in the room waiting for you to evaluate their work. They're not going to give you an honest response, are they? Absolutely not. It's like going to eat at a restaurant and the waiter or waitress stand right there while you're signing the check and putting how much tip you're going to give them. You always feel super uncomfortable, right? That you're like, oh, you totally suck, but you're right there. And I don't want you to see that I'm only going to give you like $1 or $2. So I'm going to give you $6 because you're awesome, because you're right there. So you always feel that influence, that effect that they may potentially have on you. So here you have to find the right time on how to do the survey and all these kinds of things. And the second issue then that we have to consider is that there's going to be some people who are going to come in who may just want to give you bad data, inadvertently or on purpose. And that's something that we always have to concern ourselves with. So again, it's like a patient who goes in to see a doctor. If they already have a bad attitude prior to coming in, nothing that you do will ever change their mind about them. They waited out there for 30 minutes, but they arrived 29 minutes early. So it's only really been 1 minute since their appointment started, and they're already writing a Google review about how horrible you are because they had to wait 30 minutes. So here, it's this idea of you already have people coming in with a bad perspective sometimes. And sometimes you have people who just want to help you out too. Oh, it's because, you know what, the researcher, dude, they look like a really sweet person. I've had this actually happen to me where I've had participants come in and be like, you look like a nice guy, sir. Thanks, I appreciate that. Because now that automatically tells me that anything that they do in terms of a behavior, anything that they do in terms of the data that they give me is always going to be reflective of them thinking that I'm a nice guy. So now that becomes a problem. So we have to evaluate these kinds of things, and we have to make sure that we can monitor our own behavior as researchers, as experimenters, and we also have to make sure that we can monitor the behavior of the participants, making sure that they're not giving us data that's not natural. Because that's the key. I'm looking for natural data. How can I get that data the best way that I possibly can? So now let's look at this particular issue of bias. And the first one that we're going to talk about is what we call our experimenter bias. And we talk about the experimenter because we can always take our perspective from our side as the experimenter, or even as the clinician or the counselor, right? You can put yourself in this perspective because we also go through the same thing in terms of experimenter bias from that perspective in therapy or in counseling sessions. So the first issue that we always encounter is what we call expectancy effects. The issue of this expectancy effect is treating different individuals differently outside of the manipulation. So in other words, participant number 1 comes in. They seem like a really nice person. You treat them nicer because they just seem nicer. That's outside of the manipulation. So here, you're a jerk to another person who comes in who may be all soaking wet from the rain and who kind of looks like, oh man, like I'm totally soaking wet from rain and you want me to come in and participate? Can I have like 1 minute? And now you treat them in a negative fashion because they're not following your directions at that specific time. And that treatment of that participant is outside of the manipulation that you're wanting to do. So you're not supposed to treat them any differently. You're supposed to treat everybody exactly the same, but you don't because of some particular reason that it is that you're wanting to deal with at that specific instance. So ultimately here, we treat them differently in those specific cases. We call that an expectancy effect. Also think of it in the following fashion. You're doing a research study on stress. And what you're doing is you're doing music stress on memory performance. So for group number 1, it's low stress. They have very low intensity music. It's classical music or whales or something. I don't know, whatever music it is that you want to play for them. And there's incense in the room and everything seems really nice and you greet them super nice, right? You're supposed to do that with everybody. People in the high stress group, they receive the music really loud. It smells really gross in the room. People are super rude to them. That's part of the manipulation. Fine, not a problem. But if participants in group number 2, the high stress group, are supposed to already be stressed out because of your manipulation, and then you're throwing things at them because you're like, I'm going to do extra stress, and now I'm going to start throwing things at them, that's already now an expectancy effect because you're treating them differently than what's actually prescribed in the manipulation. Everyone with me? Questions, concerns? Everyone good? Perfect. Our second issue related to experimenter bias is the issue of what we call demand characteristics. This is where essentially we treat our participants differently by telling them exactly how it is that we want them to participate, explicitly or implicitly. So in some instances, we give them the answers. This generally happens a lot, like in a general psychology class. This was always my favorite time during an exam. You always have those students who come up and be like, sir, I'm stuck on question number 7. I'm not sure if it's A, B, C, or D. Those are your 4 options, right? And normally what they're looking at is they're looking for a cue from you in terms of giving them some particular answer. So in other words, I'm leaning more towards A. And then they look at you. All right? And then you don't say anything. B? And then you go, and they're like, it's B, right? So it's B. I got you. That's the idea of a demand characteristic. That here, you may not explicitly tell them, but implicitly your facial reaction may have given it away. Or you may essentially just tell a participant, be like, really? I didn't expect for you to answer A. I thought you would have leaned more towards B. Well, great. Now they change their answer to B because you've essentially told them to answer B. Everyone with me? Now again, it's not that we're trying to do this on purpose. It's not like if we're trying to go out there and change our answers. In some instances we may, in certain demand characteristics situations, or even in some expectancy effect situations, but generally a lot of this happens implicitly, where we don't actually do it on purpose to treat people differently. And a lot of it just happens because we're unaware of it. I had a research assistant many years ago that I had to have a talking with because part of what this research assistant was doing was they were treating my participants differently without them really being aware. Because what she was doing is she was reading her text messages, and she had gotten to an argument with her boyfriend over text message. So participants were coming in to participate, and her and her boyfriend were arguing back and forth. And then participants would come in, and she would just be like, oh, yeah, just come in, sit down. Here, read this, and you'll be fine. And then when everything worked out with her boyfriend that night, the next day she came in, and she treated those participants completely different. Hi, how are you? I'm so-and-so. Come on in, take a seat. Let's sit down. I'm going to explain the experiment to you. Well, now we have a difference that's existing in our results that's not due to my manipulation or control. Everyone with me? This is what happens many, many times to researchers who don't collect their data. And I'm going to be honest with you. We as researchers don't have time to collect our data. Sometimes we pawn it off onto our research assistants for them to collect the data because I don't have time to do that. Rather, I need you to be able to go out and do that data collection. I'm going to try to train you as best as I can to do it in the best way possible, but there's no guarantee that that's going to happen in any way. Everyone with me? Perfect. This is why it's very important that if you are going to be using research assistants, sit down, have a little bit of a debriefing or a little powwow once a week with them where you buy them donuts, you buy them pizza. Hey guys, everything going well? Talk to me about every one of your participants that we collected data on. Did you guys take notes? What did you see? What did you do? What did you feel? Or maybe pop in on them once in a while, or send in someone who's a participant on your side. What we call that a confederate, right? So in this particular case, sending in someone who's on your side, sending them in to act as a participant and evaluating the research assistant, and then them coming back and reporting back to you. And here you may be like, dude, sir, you're paranoid. Yeah. Totally paranoid, because it's good data that I'm expecting to get, because I'm going to write this stuff up. I'm going to try to publish it. The last thing I want is error variance in there, right? Absolutely. And here, this happens to us all the time. As a researcher, guys, I don't have time to be in the lab. I stopped being in the lab, I don't know, 6 years ago, 7 years ago. I don't have time anymore. And I gave all my work to a research assistant. It took me 2 years to find a good, solid research assistant that I trained who saw things from my perspective and who was on top of everybody else that we then hired to be research assistants as well. And even then, we would sit down and we would have to throw out data because there were things that were happening that people were getting treated differently, or maybe they told them inadvertently, like, oh, it's because I accidentally told them that this is what we were going to be studying. Oh, forget it. Everyone good? Perfect. All right. So then how do we deal with experimenter bias? It's always a big question, right? So then what do we do? One of the ways to try to reduce experimenter bias is to try to reduce what we call experimenter participant contact. So in other words, if we're able to reduce the contact that I have with the participant, it's less likely that I'm going to be able to influence them in a negative or positive fashion as well, right? So how do we reduce that contact? One of the ways that we can try to reduce that kind of contact is by automating our procedures or automating our instructions. So what we can do is we can put all of our instructions on a piece of paper or on a recording. They watch a video, they hear the instructions, whatever the case may be. Everything is automated for them. We don't even have contact with them. We put everything on a computer, or we put everything on a TV screen, and the TV screen gives them all the steps that they're supposed to do in the completion of the project. We may just be there to supervise, but we really don't have that much contact between them. You may also want to try to practice scripts or try to practice with another person. So, hey, let's go through a couple of trial runs prior to actually getting a participant to come in, so that way we make sure we work out all those kinks in those particular situations. We generally try to hire actually a lot of students who come from like a drama department or things of that nature, because since they're wanting to get a little bit of exposure to acting and they're really good actually at reading scripts and keeping up with the script, we tend to hire them quite a bit because they're able to always keep up the same persona or the same act over and over and over again, trying to ensure reliability in those particular cases. Questions so far? Perfect. Another very common procedure that we tend to use is using what we call our double-blind procedures. With double-blind procedures, this is essentially where our participants nor our experimenter know what condition that person is in. So in many instances, we may influence them or change their behavior or treat them differently or even give them the answers of what they're supposed to do if we know in what group they're supposed to be in. If they don't know what group they're in and we don't know what group they're in because everything's been randomly sorted by somebody else and we just give them out as participants come in, or we give them the drug without really knowing what drug it was that we gave them, but it's written somewhere else what drug was given or administered, it's less likely then that we'll be able to influence them in a negative or positive fashion. Questions so far? Perfect. So then we have to look at the other side of the coin in this particular instance, or the other side of the table in this particular case, right? So we as the experimenter are on one side of the table and we're doing our experiment and we realize that we may influence people in negative or positive fashions. Now we have to turn the table and look at our participants and how they may influence us in those specific cases. And one of the ways that we actually look at it is by categorizing our participants in 3 different ways. We have what are called good participants, bad participants, and then we also have what are called socially desirable participants. Now, let me make sure that everyone understands this. All 3 of these do terrible things to your work and negatively impact your work. Okay? So the good participant doesn't do anything good for you. They hurt you. The bad participant does something very bad for you. And the socially desirable participant also gives you very bad data. Okay? Very, very bad participants that we have in this particular case. So what does a good participant do? The good participant is the one who figured out your hypothesis or looks at you and says, hey, you look like if you're a good guy, or you look like if you're real sweet, ma'am, and so on and so forth. And now they change their answers to try to help you out. You're asking me about, you turned up the music really loud and now you're testing my memory. They're probably trying to stress me out with the music. I'm going to act like if I don't actually remember that many words and only act like if I remember 2 out of the 10 words when I actually remember 10 out of 10. Awesome. That hurts us in a negative fashion because if they actually remember 10 out of 10, they should tell us that they remember 10 out of 10 and give us that data. Everyone with me? Now, bad participants, on the other hand, these are the ones who try to screw with you. We actually have what's called the screw you effect, or what we also call a reactance effect. The reactance effect, or the screw you effect, is where essentially participants react in a negative fashion to a situation and they give you bad data or they act in negative fashions to try to throw you off in terms of your research study. And that hurts you. And the reason that that hurts you is because they're trying to sabotage your work and you may not even know that they're trying to sabotage your work. So this is the participant who, for instance, may go down a survey and just answer 5 all the way down, the middle of the scale, or give you all 1s or all 9s. We've all done that. We're all guilty of doing that, to be honest with you, right? You get one of those customer satisfaction surveys and you're like, I don't have time for this, but I totally want to be in the raffle at the end. So 5s all the way down. So what ends up happening in those particular cases is we're giving bad data or we're being given bad data. And one of the things that we have to try to do is we have to try to minimize that that's going to happen. So with bad participants, generally bad participants, you can recognize them right away because these are the people who come in with a really bad looking face. They always come in all upset. They come in always just wanting to get in and get out. They don't want to do anything extra. And generally with bad participants, it's surprising. These are generally people who come in really early to a research study. So their session is at 4. They're in there at 3:30. And you're like, it doesn't start for another 30 minutes. Well, can I start now? So what they want to do is they want to get in and they want to get out as quick as possible. Generally, one of the things that we try to do with a bad participant is we try to do one of 2 things. Number 1, we deal with them and we let them participate and we flag their data and then we exclude them later on. Or number 2, since they arrive a little bit earlier, you may now have a chance to be able to try to remedy the situation. So part of what we can try to do with bad participants is we could try, to the best of our abilities, is to form what we call an alliance with them. Now, one of the things that you may want to try to do is you may want to try to have them see your side of view or your perspective as to why this research study is so important. So help them understand their role in this procedure, their role in the experiment. So as a participant, as part of this population, it's really important for us to use your data because it's going to help us be able to identify these particular problems or try to help minimize the risk of this happening in the future to other people or whatever the case may be. So here, having them become part of the team. One of the ways that I always do this is I always sit down with the participant, or the way I used to do it, and I train my assistants to do this now, is I try to have them sit down and talk with the participant and find common ground. So for instance, generally when I was a lot younger, not anymore, now they look at me and you're like, who's the old guy? But when I was younger, participants would think I was a student, that I was just one of the research assistants. So I would ask them questions like, hey, so who are you taking intro to psychology with? And they'd be like, oh, I'm taking it with Davis. You'd be like, oh, no way, I took it with Davis a number of years ago. And now you found some common ground and you ask them questions. Oh, so how do you feel, about his class? And generally they'll always say something bad. Oh, it's really hard, or it's boring, or it's dumb, or whatever, right? And you go, oh yeah, it is a little bit difficult, but hey, you know what? If you study, I've heard that, and what I used to always do the quizzes, and the quizzes helped a lot. Go and talk to him. He's really helpful. So now find some common ground with them where you can build that relationship. Now, the goal is here for them to be able to now turn not into a good participant, but turn into a participant who's going to give you good data. So in other words, they're going to give you their natural responses. Everyone with me? Now, if that means that they feel at the end of the day that you're going to baptize their child, why not? You're not going to. Okay, let me make that very clear. You're not going to baptize their kid, but give them the illusion that you will. And why? Because you need data, guys. And I know that sounds like a horrible thing and be like, man, he's horrible. No, I need data. And if I can't get data, I'm not going to publish. If I don't publish, I'm not going to keep a job. So here, I need the data however I can get it. If I convince them here that I'm on their side, if I convince them that what they're doing is very important to the field of psychology and all these things, and they now give me their natural responses, I got data points. I got another one, and I'm good to go. At the end of the day, hey, can I add you to Facebook or to Instagram? Can I Snapchat with you later? No, get out, because I need the next participant to come in. That's what we're trying to do here. We're trying to get the data as best as we possibly can. We're trying to help them as best as we possibly can by helping them get the incentive, but at the same time, we need them to help us. Because the last thing that you want is to have bad data points within your data and you not notice. One other easy way to kind of deal with the bad participant, I've done this in the past, is have a bowl of Jolly Ranchers or candies. Jolly Ranchers work really well because they come individually packaged. Offer Jolly Ranchers to a bad participant. Generally, you'll get rejected pretty quickly. No, I don't want Jolly Ranchers. They suck. And you're like, come on, who says that Jolly Ranchers are terrible, right? No one. So you okay, not a problem. You talk to them for a little while, find common ground, start forming a little bit of an alliance, offer them another Jolly Rancher. See if they'll take it. If they do take it, good. They've taken something from you. Now they feel that they owe something to you. So here, they're much more likely to participate and be on your side. If they still refuse to take it, you eat one. You tend to eat a lot of candy, apparently, in my world, right? So you now take a candy and now offer them again, or just give them a piece of candy, put it on their table, ask them to eat it. If they do choose to now eat it, generally, you're good to go. And why? Because no one can be mad and eat a Jolly Rancher at the same time. Try it. Go home, buy some Jolly Ranchers. You'll see it. You can't be mad. You'll be like, fine. You generally agree. You just can't be mad with Jolly Ranchers. That's why nobody's mad on Halloween. We're all happy because we're all good with candy at that point. But granted, that doesn't always work for everybody. So you have to find your own way to deal with it. Find your own way to form that alliance with them because it's very important. And if they're a bad participant and you just don't want to deal with them, again, since they're generally there early, let them go. Just be like, oh, you know what? The computers don't work. Sorry. That's all right. I'm going to give you credit anyways. You can go. And they're happy to get out of there. And why? Especially if you're waiting for other people to come in and participate, that one bad apple will spoil the bunch for you. So you have one bad participant. waiting in the room, they will ruin it for everybody else. They will start talking to other people, be like, oh, this sucks, dude. I can't believe they're making us do this. And now everyone's perspective starts to change. And now rather than one bad participant, you got a room full of bad participants. And that's what you want to avoid. Everyone good? Perfect. Last, the issue of having a socially desirable participant. Socially desirable participants are participants who try to give you the right answers. They're the ones who want to look good for you. So in other words, these are the people when you ask questions like, hey, how many sexual partners have you had in the last 24 hours? They're going to look at you and be like, none. None, I don't do that. I don't do that kind of thing. I go to a Catholic school. What are you talking about? I don't do that. I don't do that kind of thing. When in reality, it's like 4. And you're like, okay. And you don't know that. You can't be like, no, we followed you last night. And we saw you. You can't do that, right? Or you can't be like, really? Are you sure? You can't really do those kinds of things. So rather, what will these participants do? They'll give you the right answers. They'll tell you what it is that they think that you want to hear or to make themselves look good. In social psychology, we always talk about what's called the Hawthorne effect. The Hawthorne effect is the idea that if we feel that we're being observed by other people, we generally are going to change our behavior around. So at work, for instance, the boss leaves, we all goof off, we all, do other things. We really don't do our job at 100%. But as soon as we see the boss pull up, or we hear the door open, or we hear our boss's voice, man, we're all typing away, we're folding clothes, we're serving burgers like if there's no tomorrow, and we have this great looking face of like, it's awesome, I love it, my career. And why? You change your behavior because you feel that you're being observed in that particular instance. The same thing happens for us in experimental settings. So how can we remedy these situations? Good remedies for reducing participant bias. Number one, for a good participant, don't tell them what you're wanting to study. Don't tell them specifically what your hypotheses are in your informed consent. While you're talking to them, don't specifically tell them. You may have to resort to using deception, passive or active deception, lying to your participants, or just kind of hiding the truth from them and telling them something a little bit different than what the reality is. Always remember to treat your participants with respect, even the bad participants who come in. Generally, if you can form that researcher-participant alliance with them, you're much more likely to be able to use their data rather than not being able to use their data. For bad participants or for socially desirable participants, try to use implicit measures of behavior. So in other words, use measures and hide their intent that are sensitive in their nature. So in other words, use filler items, use implicit measures of impression management, for instance. Don't tell them what it is specifically that you want to measure. And one of the things that you can do, for instance, you want to measure prejudice levels. Have some questions about prejudice, but also have some questions about self-esteem, other questions about motivation, other questions about political affiliation. Questions about all these different topics so that way they don't get caught up on the idea of they are only asking me questions about prejudice. I'm going to look like if I'm a prejudiced person, I'm not going to answer truthfully in this particular instance, and they become a socially desirable participant. Or also use measures of impression management. We're essentially here, we can give participants lie scales that ultimately give us an idea of how much a person may or may not lie. We all lie. So if a participant scores that they don't lie at all, they're lying to you, right? That's generally the way that we interpret that. We can also use what's called a bogus pipeline. We're all familiar with lie detectors, and we all know that lie detectors don't technically detect lies. We just assume that they have physiological changes or physiological responses to questions that they may potentially be lying to. So here you hook up a participant to a lie detector machine, they'll freak out and they'll be like, oh man, I gotta be truthful because they're gonna know that I'm lying anyways, so I might as well just go ahead and tell them the truth. And we thank the popular media and crime shows for doing that for us, so we're very happy for that. Thanks, CSI. Right? So ultimately here, we can see that there's a lot of issues that come up whenever it is that we're doing experiments or that we're designing studies. And one of the things that we want to try to do is we want to try to minimize the effect of all these particular things. And now it's coming to the realization that it's not just the participants, it's not just the experimenters, but it's everything within an experimental situation that might potentially be contributing to this effect. Questions, concerns? Everyone good? Perfect. All right, so on my watch, I have 5:20. So we'll do the following. I'm going to talk just for a little while longer. And the last thing I need to talk about for today is we're going to talk about our abstract. That's it. That's all that I have for today for you guys. It was going to be a brief one because I know that many of you are getting ready for moves. Many of you are getting ready for your finals or doing other things. And I want to give you guys a little bit of a shorter day. I didn't think that you guys would complain. Will you? I didn't think so. I didn't think at all. Absolutely. And it's probably, 1,000 degrees up there? Yeah. Yeah, I can see that, yeah. Yeah, it's a little humid down here. Today it was 102. Yeah. No? Yeah. I showered this morning, and as soon as I walked outside, I was already drenched in sweat. And I was like, yeah, thanks, Brownsville. Thanks. That's right. I love this place. Thank you. So the last thing I want to talk to you guys about today is I wanted to talk a little bit about the abstracts with you and what it is that we're going to be doing with our abstract. Okay, so for your abstract, it's short. It's 150 words. That's all that I'm going to give you for your abstract, 150 words. Generally, it's between 120 to 150, depending on the journal that you submit to. I'm going to give you guys up to 150. Now, within your abstract, there's a lot that you have to talk about. You have to talk a little bit about the background of your study, introducing the topic and the background. You have to introduce a little bit about the methodology, how you're going to do the study, what you would predict is going to happen, right? So the idea of the hypothesis. A little bit about what your results mean. Sure, I can go through that again. So introducing your idea and the background. So what's the background? It's your lit review. So introducing a little bit about the lit. So the purpose of this study is to examine the effects of stress on memory. Prior research has identified that as stress goes up, memory performance tends to go down. So you've already talked about those issues. Next, you're going to talk a little bit about the method. So to examine this issue, we're going to give participants loud aversive music versus soft non-aversive music, and test them on a list of 10 items. So we talk a little bit about the methodology that you guys are already writing. And then second to last, you're going to talk about what you predict to happen. So the idea of the predicted results. So what do we expect to happen? So we predict that as stress or as having a loud aversive stimulus go up, we're going to have our memory performance go down. And then the last thing that we're going to talk about, what do your results mean? So if this result were to be supported, what would that suggest? Here, that means that we talk about the discussion section. Although we're not going to write a discussion section this semester, that's the idea of having that in the abstract. What would the results suggest? What would that benefit? How would we use it? You can write about anything related to that. All of that within 150 words. My recommendation is write. Don't worry about word count. Hit all those specific issues. After you've hit all of those issues, check the word count, then go back and start editing it down. You're going to be a lot more verbose the very first time around. If you have the word count already in your mind that I have to keep this to 150 words, you're going to end up writing 50 words. So rather write and then go back and trim. Everyone good? Concerns about your abstract. Your abstract is double-spaced, Times New Roman 12-point font. The word abstract appears at the top center of the abstract. The abstract is not indented. No indent. After the abstract, yep, go right ahead. No, go ahead. It will be due on the 30th. Sunday the 30th. So I'm going to open it up for you guys now, and you'll have between here and the 30th to finish it. That's it. Okay. Any other questions about the abstract? Perfect. Don't forget the running head And don't forget your page number, right? And the page number, don't worry about it being in chronological order or anything like that. Just put a page number on there. It will be page number 1. All right. What was your question about the method? Okay, no problem. So your method section is going to be made up of 3 parts. Your participants, your materials, and your procedure section. Those are your 3 subsections. So your participants, you're going to describe who you want your participants to be, how many you expect that you would want to use in your study, and where you're going to get them from. And any other key demographic information. So in other words, they should be male, between 18 to 25 years old. They should come from a 2-parent family, X, Y, and Z. So you should describe them in enough detail where we would be able to understand where you're getting these people from. And who they are and what they look like. Everyone good? Section number 2, the materials. The materials are going to outline for you what materials you plan to use in your research study. So you generally start with the informed consent and you end with the debriefing. So what are your materials? The materials can be surveys, they can be assessment tools that you're giving, they could be an fMRI machine that you may be wanting to use, anything that you're using as a tool or as a technique in the material section. So if you're going to use an intervention technique, you should describe that in your material subsection of the method. So in other words, we're going to be using, electroshock therapy. I don't know, something extreme, right? You describe it there and you explain what the procedure is and how it's done. And then if you have to give us any information in terms of what kind of machines are used to provide that kind of treatment, that should come as an appendix. So in the appendix, we should be able to see a picture of the machine that you use to provide the shock. So again, it begins with the informed consent and it ends with the debriefing. Generally, what I always like to do, if you guys look at the sample, I do everything in subparts. So the materials has subsections. So the informed consent is the first part. Then it's the demographics questionnaire. Then it's the manipulation that I'm going to use. Then it's the test that I'm going to give them. And then last is the debriefing. So I always go in the order of what I expect the procedure to be as well. But that's up to you. You don't have to do that. That's the way I like to do it, but it's personal preference. Any questions? And then the last section is your procedure. In the procedure now, you describe to us exactly what should happen during the course of the study. So in other words, during the course of the study, the participants are going to be coming in for 3 different treatment sessions. Session number 1 will occur at the initial start of treatment. Session number 2 will occur 6 months afterwards. Session number 3 will occur 2 years after the initial session. During each session, these are the things that a participant will be experiencing or will be completing. And then you describe what they should be doing at each one of the sessions, how long each session is, and everything like that. Anything that should happen during each testing session should occur during the procedure. That should be discussed in length. Now here, for everyone, your procedure sections are going to be different. For some people it may be a page and a half, for others it may be 2 pages or 3 pages. It just depends on your length. Don't be married to a specific length that somebody else has completed, because everyone's studies are different and everyone requires different explanations and different lengths of explanations. Yes, so your participant sections, you should be describing who they are, where it is that they're coming from, and what they look like. So in other words, we're going to be looking at males. They should be 18 to 25. We're going to grab them from the larger San Antonio area or from Bexar County, or whatever it is that you want to describe about your participants. You can describe them on any capacity, on any quality that you want, as long as it relates to your study. So for instance, you don't need to talk about what kind of music they listen to if you're not doing anything related to music. You don't have to talk about their age if their age isn't important. You don't have to talk about their gender if gender is not a specific component of interest. It's just whatever it is that you think the characteristics are that are important. So they should suffer from depression. They should have already been diagnosed with having this depressive disorder based on the criteria from the DSM-5 or whatever the case may be. Absolutely. And then the last thing that you should do is you should have your appendices. Your appendices are your materials. So the materials that you described in the material subsection of the method, we should have each material being presented. And again, I've given you guys templates for your informed consents, for your demographics, for using surveys or for creating your survey, and also for your debriefing form. Any other questions or concerns? All right, guys, we're all done for the night. I want to give you guys an easy night. All right, guys, have a good rest of your day, and I will see you all on Tuesday. Bye-bye, guys. I'll see you on Tuesday.